ever feel overly hurt when someone criticizes you, even if it's only a minor criticism? Do you worry so much about rejection that you would rather be alone than take the risk of connecting with random strangers? Do you feel overly dependent on the people that you do feel comfortable being around? Are you self-critical to the point that you feel like you know that you will never be accepted by anyone outside of the few close friends and family members that you have chosen to be comfortable around? If you have any or all of these issues, there's a very distinct chance that you have avoidant personality disorder. Avoidant personality disorder is one of the 3 cluster C personality disorders, along with dependent personality disorder and obsessive compulsive personality disorder. Something all of these personality disorders share is a feeling of anxiousness or fear, either of abandonment, of not being able to do things the correct way, or, in the case of avoidant personality disorder, of the people around them. Some might compare avoidant personality disorder to antisocial personality disorder based simply on the names, but that's a common mistake. Someone with antisocial personality disorder lacks empathy and respect for others, while someone with avoidant personality disorder lacks respect for their own selves, not for the people around them. In many ways, a better comparison would be to compare avoidant personality disorder to social anxiety disorder, though avoidant personality disorder is a bit more specific. Social anxiety disorder deals more with encasing all of the social anxieties together to create one larger package, whereas avoidant personality disorder focuses more on a specific fear of rejection, or fear of criticism, or fear of acceptance. Someone who has avoidant personality disorder likely has, at the very least, some of these symptoms. They avoid activities that involve a large amount of interpersonal contact due to being fearful of criticism or rejection. They are afraid to attempt to become socially active unless they know it will be in a situation where they will be liked. Their fear of being criticized has made that person less intimate. They are focused far too often on being fearful of being criticized. They are almost always inhibited in social situations. They believe that others see them as being inferior to others. And they are incredibly reluctant to take risks that may prove embarrassing. Generally, it is accepted that at least 4 of these symptoms or conditions need to be met. But if you have any of these symptoms, it may be wise to seek consultation. Someone who knows someone who suffers from this disorder may find it hard to understand what makes an avoidant personality disorder sufferer tick, especially because that person will do everything in their power to try and prevent you from even talking to them for a second, let alone get to know them. It's not just about being afraid to talk to people. It's about being afraid to even stand in the vicinity of unknown or known people because of a fear of criticism or rejection. Someone with APD refuses to give most people a chance to help out simply because of their own fear of getting close to someone. What causes avoidant personality disorder? This can be a tricky question to answer, but there are potential causes. It's entirely possible that avoidant personality disorder is related to other disorders related to schizophrenia. There are also possibly biological and or psychological influences that can cause avoidant personality disorder. One particular possibility comes in the form of parental influence. Rejection or a lack of uncritical love from parents after birth may lead to further complications through adulthood, including low self-esteem and a fear of social interaction. In a study performed in 2011 in Canada on the impact of neglect and abuse of children by their parents, it was revealed that almost 60% of the people who were studied that had been abused as a child could be diagnosed with avoidant personality disorder, while over 55% of those who were neglected would also be diagnosed with the disorder. More than half of the people who were either abused or neglected as a child that were contacted through this study were considered to have, at the very least, symptoms of avoidant personality disorder, if not, indeed, sufferers of avoidant personality disorder. Another possibility is one that hits on a more personal level. Remember, it has been established that it's entirely possible for psychological influences to cause avoidant personality disorder. With this in mind, there can be a direct link established between APD and another form of criticism: bullying. Someone who has been bullied has been made readily aware of criticism and rejection at an early age, a problem that could stick with a person long after the bullying stops. Avoidant personality disorder is a serious mental condition that can help to make someone invalid. If not treated, a person with avoidant personality disorder may develop further mental health disorders, and may also decide to live in a life completely isolated from others. It is imperative that someone who is either suffering from avoidant personality disorder or may believe that they are suffering from avoidant personality disorder seek help for their condition as soon as possible. When someone who has APD does decide to seek help, they will be thankful to learn that there are treatment methods in place to attempt to help someone with this disorder. One of the many methods being attempted is the implementation of behavioral intervention techniques. These techniques are designed specifically for people who have anxiety and social skills issues. The idea is to help encourage someone with APD to participate in social situations that would otherwise make them extremely uncomfortable. It would be hoped that emphasizing these social situations and enforcing these situations on a daily basis, or as often as possible, will cause this discomfort to subside over time and perhaps help them to realize that overall there was nothing to fear. It is also possible to use many of the same treatments that would be used for social anxiety disorder on someone who has avoidant personality disorder. One particularly good example would be the use of cognitive behavioral group therapy. In this program, groups of patients would be able to rehearse and prepare for situations that cause social anxiety in front of people who share their awkwardness and fear. This kind of treatment is especially important because it not only establishes that people in these programs are now aware that they are not alone in their suffering, but it also gives these same sufferers an opportunity to shed their social skin together and with people who know what it's like to have social issues. Again, it must be stressed that avoidant personality disorder is nothing to sneeze at. It is a serious mental condition, and it is also a serious mental condition that can be treated with the right treatment method and the right amount of support from your friends, family, and therapist. If you have any of the symptoms mentioned earlier, please seek help as soon as you can. The sooner you seek treatment, the sooner your crippling problem has a chance of being defeated.